Okay, now with that particular focus, if I want to get insurance, I can go to an agent, and I can say to the agent, okay, please help me out with my insurance needs.
Mm-hmm.
Or I can go online to healthcare.gov, and I can try to get the information from the navigators from the site. Am I correct so far?
Right, absolutely. And what's important to note is that the premium is the same. So whether you use an agent or use a navigator, you do it yourself, it's always the same. Doesn't cost anything extra.
Now, are the policies the same?
Absolutely. Policy is the same. Okay. Everything is the same.
So then the reason why I asked this is because I went online and I saw an insurance policy that I thought would be helpful. I had talked to a navigator. I talked to a insurance a broker, and I was very confused because the information that I got online indicated that the co-insurance did not have a cap. So the co-pay, of course, you're talking about a co-pay and a co-insurance.
Right.
Now, according to the insurance policy, the co-insurance did not have a cap. But when I talked to the navigator, they said, no, this is capped by law. So, for example, the 20%, the 30% that would be for co-insurance.
Right.
I found that, at least according to the navigator, that I wouldn't have to worry about the 20%, 30% over and above the out-of-pocket costs, and that's separate from the deductibles. So,
and I'm not sure what kind of information that you got, but there's so many different plans that you could pick from, and there are parts of the law that caps the out-of-pocket, but different ones operate different ways. Some might have a deductible. You have to satisfy your deductible, and then everything's paid at 100%. Or some might have co-pays. I know Louisiana Co-op, very different. Their co-pays go towards your deductible. So there's a lot of little nuances. Some of the Blue Cross plans actually have a $500 deductible for prescriptions. That's in addition that people don't realize. So there's a lot of different things with each one and then again, if you're between 100 and 250% of poverty, then those plans, you pick a silver plan, your deductible is reduced, your co-insurance is reduced, your co-payments are reduced. So it gets a little bit complicated.
Yes, indeed. Sure, it does. But get back, and I understand what you're saying about the differences in terms of deductible and the co-pay and the co-insurance and deductibles going in for the out-of-pocket caps. But as I appreciated, the main difference with this law is that the law says that the insurance company cannot make the insured pay for anything over the out-of-pocket caps. But the policies themselves would indicate, like, for example, let's say you go to the hospital and you have a $100,000 bill. Well, you have a cap for $6,000. So as I appreciate it, anything over the $6,000, the insured is not going to be responsible for. If that's the cap, if the cap is $8,000, then that's all you're responsible for, despite the language of the policy that says 20/80 or 30/70 for the co-insurance.
The way that it works is that you have a deductible, you satisfy that, and then depending on the plan, whether it's 80/20, 70/30, the insurance company pays the 80/70, you pay the other. Once that total ends up to equal your out-of-pocket, like you explained, 6,000 or 8,000, then your plan is paid at 100%. And what the law did was eliminate the annual or lifetime max, so it'll never max out. But every year, your deductible and out-of-pocket starts over.
So, assuming that's correct, and that's my understanding too, okay?
Mm-hmm.
And not looking at, whether or not this is going to, quote, bankrupt the country or anything of that nature,
Mm-hmm.
but just looking at the policies as they are, and not considering, privacy issues or anything like that, just the policies themselves, that sounds like a pretty good deal for the insurers.
Well, I'll tell you the good, bad, and the ugly. If you're
Sure.
under 100% of poverty level, there's no help. So if you're talking to somebody that says, I make less than $11,500 and you're a single person, you tell them that they have to go to a free clinic. It's heartbreaking. If you make between 100 and 400% of poverty, then absolutely the federal government helps you pay for your insurance premium, and then sometimes your deductibles are co-payments. With those over 400% of poverty, the rates are either double or tripling. So good, bad, it helps some people. It's going to make some people pay more. It just depends on where you fall into the category. So those that can get a subsidy, absolutely it helps them, but it doesn't help everybody. And I guess that's the law.
Yeah. Now, you mentioned about if you're under, say, the percent and below. If you're in Louisiana, then you got to go to, say, these clinics or the hospital or the whatever the emergency room might be.
Right.
Because the governor has not extended the Medicaid. But in other states, the government has extended the Medicaid. Am I correct?
Well, he decided not to expand Medicaid, and I'll be honest, it was very confusing during session last year. People didn't understand. I honestly don't understand even if we expand Medicaid, if it's going to help those under 100%. My understanding is that it was going to help those 100 to 138%. So if you were on you're an employer plan and you were in between 100 and 130%, 38% of federal poverty, you could get off your employer plan and you could get Medicaid. I'm not sure, and I actually have a meeting this afternoon with DHH to find out, does this even help those under 100? And a lot of people think Medicaid is for the poor, and it's not. It's for, if you're pregnant, if you're a child, if you're disabled and you're blind. It's not for the poor, and it's not for the working poor. And the law, ACA is not for the working poor. So we need to figure out really, does Medicaid expansion help those under 100%? And if it doesn't, then Louisiana needs to create their own legislation that helps that group of people that are having to go to free clinics or a lot of the hospitals that's been closed, so they don't have a lot of options to get help.
Yeah, it's my understanding that, and the research I have done, is that basically if you're 100% and below, that you don't have any choice at all.
No.
But that if there was Medicaid extension, it would help out those people who would be, say, within that bracket. But if you have any information that the DHH provides, I definitely would like to to be updated. But that's information that was provided to me, at least by advocates of the Medicaid expansion, and so I'm just going to go by that at this point until I hear otherwise.
It seems like you hear different things from different sides, and it's like you just want to hear the truth. The truth. What does it really mean? And I guess you have to meet somewhere in the middle.
And that's really what I've been trying to do. And quite frankly, I've been trying to get an idea as to who this helps and who it doesn't help, and why. I mean, to me, it doesn't make any sense that the state doesn't extend the Medicaid for these people unless they have a system in place that will, say, substitute for it.
Right.
But if they don't have a system in place that's going to substitute, then to me, I think it's very injurious to the people who need it the most. And so that's why I'd like to find out what system they would have in place.
And that's one of the things I've been trying to find out because the legislators are confused. I read an article about one of the senators the other day that thought it helped people between, actually thought that people under 138% of poverty didn't get help in Louisiana, and that's not true. So I think there's so many misnomers out there that we need to get to the facts and then figure out what is going to help the people in Louisiana.
Definitely agree. Now, as far as you said about doubling and tripling, I've done some research. I put together some hypothetical situations, and my numbers might be a little bit off or so. But for example, a person who's making $100,000, 50 years old, single. So single, male, $100,000, living in Jefferson Parish. The most that he would pay would be, or she would pay, would be, and I'm just ballparking it, but roughly about $10,000 or $11,000 period. Okay, that's including a year, and that's including the deductible and the out of pockets. And so that's what I'm trying to figure out. Well, if that's what they're saying on the website, then how in the world can the policies be doubling, tripling, and the out of pocket and the out of pocket cost be any more than what the out of pocket cap is?
Right. It's a little bit more confusing than that. Yeah, it's a little bit more confusing than that. It's definitely based on, zip code. That's important. No more male or female. But the rating ratio used to be like 1 to 11. Now it's 1 to 3. So if a young person is charged 100, the most an older person can be charged is 300. So those younger people are going to have huge rate increases. Older people or sick people that might have been getting rate increases because of their illness, theirs might actually come down. It's going to make them come more to the middle. So you can't really say one person it's going to affect one way. It's just that group of people based on their age. So it's the 50 and older might actually turn out pretty good for once.
Yeah, or somebody with a pre-existing condition who couldn't get insurance for that particular condition, or maybe couldn't get insurance at all, or had insurance and got kicked off, or found out that it wasn't covered because the insurance company, as we know, has a way of trying to stopping their own hemorrhage.
Right. Well, that was the one reason why rescissions was included in the bill, that an insurance company couldn't find out you didn't tell, about a toenail fungus and cancel you because you have leukemia. But Louisiana already had laws, so we didn't do that here. But across the nation, they did do things like that, and that was a protection for people who had something really wrong with them. They had a cancer, and an insurance company couldn't go and rescind their policy unless it was because of fraud.
Okay, that's new to me, I must tell you. So, like, if prior to the law, if I wanted to get insurance and I had a condition and I disclosed that condition, as I understood it, at least the agent would say, "I'm sorry, but you have to wait a year or 2 years, whatever it may be," and I think it was 2 years before they'll cover that condition. Assuming that you don't have any occurrences, any paid occurrences for that condition.
Each company wrote different, and each state, of course, is state regulated, so each state is different. But some insurance companies wouldn't take them at all, and then some might have a rider that says we'll cover it after 2 years. But in some states it was happening that somebody didn't disclose it was something minor, that maybe they didn't even think about it, and the insurance company found it and used that as a way to cancel their coverage. But like I said, Louisiana didn't. We already had laws, but the passing of the ACA stopped it from any state doing that.
Okay, now, so as we understand, some people are benefiting and some people are not going to benefit from the deductibles. In terms of what the premiums.
Right.
some of the premiums are going to be, higher than in the past, and for other people, the premiums will be either the same or lower.
Right.
The out-of-pocket caps, however, is a tremendous benefit for the insurer. Not so great for the insurance company, and maybe not so great for the taxpayers of the United States. Is that a fair statement?
Well, I definitely think that having caps is helping the person purchasing the insurance, because that means they have to pay less out of their pocket. So it definitely helps them. But you're right, the trickle down of who it actually affects, taxpayers, that could come into play. But if you're just talking about an individual, then absolutely, if I'm buying insurance, having a cap on my out-of-pocket definitely helps, especially if I get some severe illness, get put in the hospital or whatever. Then you know what the worst-case scenario is.
Yeah, like a couple of years ago, for example, I had a kidney stone, and the bill all total was something like $80,000 or $90,000. And I'm going, my God! I mean, a kidney stone costs $80,000 or $90,000. So if that were to happen, say, to me or somebody else, now there would be a cap. There would be a cap, and I wouldn't have to pay the 20 or 30%. I would just pay the 20, 30% up to the cap.
Right, and really out-of-pockets have been in play forever. I mean, they have always been a part, but this just makes sure that they're not any that are extravagant and really high. So all the plans, sold have to meet the rules of the ACA.
Yeah, I certainly appreciate that. Should it?